Okay. Thank you all very much. You're probably used to hearing that it's always the dubious position, the one that's standing between you and lunch, and that's kind of where I'm placed, and we're talking about food. I'm really building on what all three of the presenters already have really talked about, but come at things a little bit differently. I am a registered dietitian, but I'm not a practicing dietitian. And I don't normally counsel WIC participants. My work is primarily working in underserved areas, primarily the border colonias on the South Texas border with Mexico, and now increase that to include the southern border of New Mexico and also Arizona. So I come at things as somewhat of a researcher and someone who's engaged in the community, who spends a lot of time listening to people. We do interact with a lot of the different programs, but it's more finding out what the individuals, what the families in the communities think, and what they experience. So, the game plan for my short time is to think about cultural appropriateness, but house it within this idea of context. Talk about the appropriateness and adequacy of the food package, gaps in access to foods, gaps in nutrition education, thinking about participation, both getting people to start and getting people to stay, and then identifying some missing links. And again, some of this may be repetitious from several of the previous speakers, but we'll look to build on it. Oftentimes we think of this relationship between resources and nutritional health, that if we can just solve the resource problem, whether it's at the individual or it's economic or family or the community, that we can end up with nutritional health. But what it fails to keep in mind is that there's a contextual overlay that we've got to be cognizant of. Part of its culture, part of its network, part of its personal, there's socio-political things, and it's to recognize that those resources are greatly influenced by this context in which people live. And we think about that even with good programs that provide potential access to food and other resources, the question is, do people utilize them, and how do they utilize those? And it was just pointed out, just talking about language. I mean, there's so many nuances of language. We find that with Spanish that we work with in South Texas, depending on where, on the state that they came from in Mexico, could be totally different. And it's most definitely different when we go into New Mexico and Arizona. So, thinking about culturally appropriateness in context, the populations that we work with are extremely low income. 75% of the poverty level and below. Low income, low education, the areas are functionally rural. So you might as well be living in remote areas because there's no public transportation, but yet you have a lot of folks that are living there. There's various food preparation and storage facilities within homes, and oftentimes that's not taken into consideration. This idea of a single Hispanic or Latino targeted approach fails to meet the needs of folks for whom the usual program does not apply. And then locational disadvantage. And for that we mean not being able to get to even grocery stores, much less to the WIC clinics. That they're not accessible to so many of the folks. So then you think about, okay, how do people go for the nutrition education? How do they go for the recertification? All of those type of things. And then this idea of reinventing tradition is thinking about how can people think about and develop the skills to be able to more or less bring their traditional foods that they're used to, but use foods that are here. I'm always taken with the idea of acculturation. And we think of acculturation a little bit differently because we're looking at least 95% of the population is from Mexico. 91% of the population speaks only Spanish. So what does acculturation mean? What is the major group that's there? When we think about the acceptance, one of the problems that we've identified in the community has been lack of information on changes. Changes that take place, whether it's yogurt or it's canned beans, that information is not often conveyed. The idea of whole wheat. The populations that I work with are definitely not whole wheat populations. Definitely not whole wheat bread. They will eat corn tortillas. Forget about whole wheat pasta. And forget about brown rice. These are not appropriate. These are not acceptable in our area. Cheese, the one thing that folks would like to be able to do is to be able to get their white cheese from Mexico, because that's what they're used to. Milk, several have touched on the idea of on the problem with lactose intolerance. I think just being able to get 2% milk in Texas would be wonderful. I mean, it would be in the right direction, and it would be more acceptable for those who don't like the 1% of the skim milk, and then definitely the alternatives for those who are lactose intolerant. And then finally, and it was pointed out in several presentations earlier, is thinking about, okay, where's the meat and the chicken and the fish, and thinking about, how do we provide, how do we make available even canned chicken, and so we think about fish, canned tuna, but it's only for certain eligible folks. And then think about canned fruit. In Texas, we don't have canned fruit, not even in its own juice. So why not be able to do something like that? And we've also found in our area there has been virtually an elimination of the use of vouchers. So you can't, those are not provided as far as going to farmers markets, or in our areas it would be the pulgas, because the pulgas are similar to an outdoor market. And that's where we think about product availability and thinking about alternative food sources, where people go and where they can buy foods, where they can purchase foods and purchase them inexpensively. Several folks have talked about why people may not start the program, and definitely why they don't stay in the program. I know Dr. James talked about the lack of foods that they eat, and I think this is part of it. I think knowledge and skills is another part of it. Awareness of the program, because there's very little outreach. At least in our area, WIC becomes something that's more reactive. Sitting in an office, it's almost like a retail store in a mall. Sitting in an office waiting for people to come in instead of reaching out and going out into the community. Transportation is most definitely an issue. Transportation getting to the grocery store, transportation getting to the WIC office. The location of the WIC offices. If there was some way of thinking about how can we place them more in the community, even on a part-time basis. Whether it's housing them within some of the faith-based organizations, which are really close into the community. And the hours for people that work. Forget about trying to be able to go Monday through Friday. And in our area, there's one clinic that's open one Saturday a month in the morning. But in most of the other areas, that's not even provided. And as I mentioned, there is very limited community outreach. As far as gaps in nutrition education, it's for people to be aware that there are options. In talking to folks within our area, some of the options that are available, they were not even aware of. They thought they only had to take beans as dried beans. They didn't realize that they could also choose canned beans. So how do you get that information out? And think about, how do we tailor this to the context, to where people are provided with the information to be able to stretch their meals. And this could be done through hands-on cooking. I know I talked to a colleague of mine in Arizona, and their WIC program is now doing essentially somewhat similar to a case management. So they're going out into the community. That's not what's happening in our area, but most definitely something that's very important. Missing links, community engagement. I think community engagement, outreach, listening to the voices of the participants. I know there's been focus groups or practicas conducted with people. It's not been the case in our area. And I think as we think about the individuals, the families that participate in the program, we really need to hear their voices and listen to their voices instead of taking somewhat of a top-down approach. And then finally, the key to everything we do and the key to the community is engaging promotores de salud, or community health workers, because they are trusted by the community, they serve as a cultural bridge. They really can take so much of the information to the community. And I'll end with one little thing. I really like the grocery diagram that was just shown. We developed with one of the projects that we work on. We did a mother's activity while the children were engaged in group discussions, and one of it was developing a grocery store game. And the game is something that the mothers really liked because it helped them see how you navigate a store, but they pulled cards as to situations that would occur. The child came running over with the wrong kind of cereal, or there was a coupon, but you had to buy 2 of something, but you only needed 1. And it was really a way of thinking about alternative approaches to education. We do a lot with bingo, because our participants, they love bingo, whether it's on cancer awareness, nutrition education, or stress management. Thank you.